Checking connection. Hey. All right, and we are going live. Hello, everybody. Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. And as you guys know, it's the time I get to spend with you guys and answer all your plastic surgery questions, okay? We also get to go over some important plastic surgery topics. And once I'm done with this, like I said, I'm happy to answer any question you may have regarding really any procedure from head to toe. And whether we're talking about pre-op, post-op, the procedure itself, etc. We can go over anything that comes to mind, okay? But today we are live once again on Instagram, TikTok, and YouTube. All right, and so happy to take all those questions. But before that, I wanted to talk about something that came up recently in our Facebook group. For those of you who may not know, we have actually a Facebook community group, okay? And you should all go there and check it out, especially if you're about to have surgery, because we have a lot of our vets, a lot of our Earl Pearls that have had surgery before that are on there. They're super, super helpful, super positive. It's a great place to go if you have questions, if you're looking for advice, all these things. So I highly, highly recommend that. Earl's Pearls community, look that up, Facebook group, okay? But something that came up recently was there was a question about fat necrosis, right? And so that brought me to think about today's topic, which is, okay, why don't we just go ahead and talk about what happens to the fat when you do fat transfer. And now this is, of course, what I do here is BBL, but, this really applies to fat transfer to anywhere. There can be fat transfer to the face, to the lips specifically sometimes. And there can be fat transfer to the breast, and of course fat transfer to the buttock, which is what we typically do here. Your BBL, or if you're actually going, for a signature, you go for the SO BBL or the South Beach butt lift, which you can only get here at Pure Plastic Surgery. Okay, so all right. So what there are three things that could potentially happen to the fat. So you grab fat from one place, you want to transport it to another place. You're essentially doing a fat transplant, okay? And once you do that, there's three possibilities, okay? It either gets absorbed, okay? So basically it doesn't survive, it dies, and it gets absorbed by the body, okay? Number two, it basically forms a scar ball, which we call fat necrosis, which necrosis means death, so it's fat death. But it doesn't get absorbed. So the fat dies, but it doesn't get absorbed, so it becomes basically scar tissue, okay? Or, of course, the outcome that we all want is survival, right? We want that fat to survive and live in its new location, a successful fat transplant, okay? So let's delve into those. All right, so absorb. So what happens when the fat gets absorbed? Well, what happens is that basically you have a fat cell, right? And you're taking this live fat cell and you're transporting it from one portion of the body to another, and then you want that fat cell to survive in its new home, okay? So in order for that to happen, well, this fat cell needs to get oxygenation and needs to get nutrition, all right? It needs to get nutrients from the surrounding tissues and eventually needs to get its own blood supply, all right? So all those things have to happen in order for this fat cell to survive. But what happens? Sometimes, it doesn't get any one or multiple of these things. So, say for example, the question always is, why does fat survive, or why is fat survival not as good in the hip area as opposed to the buttock itself? And that's because the hip area has a lot less blood supply, just in general, okay? So because there's less blood supply overall, that means that, these fat cells, some of these fat cells may not get the adequate blood supply that they need, and therefore that cell dies off and your body absorbs it, okay? So blood supply is a big one. What's another reason? Pressure, right? So that's why we tell all our BBL patients to not put pressure in their buttock and hip area, and in the areas where we transfer the fat for 6 weeks, okay? Why? Because these cells, once you get them from one place and put them in another, they become delicate. Let's put it that way. They become delicate. Actually, what really becomes delicate is the cell membrane. You guys remember your biology? Everyone's like, no, please don't talk about biology. All right, but it's important here. So the cell membrane becomes fragile, let's put it that way, once you transfer that fat cell. So whereas you can now, I can sit on my buttock normally and nothing's going to happen to the fat that I currently have in my buttock. When I transfer a whole new cell there, a cell there that's not perhaps getting as much blood supply as it had before, it's not getting as much nutrients as it had before, well, that cell then becomes fragile, and then on top of that you put pressure on it, well, you can burst that cell membrane, and of course then the cell dies and all the contents of the cell leak out. All right, which brings me, so what are the contents of the fat cell? Well, I mean, there's a few things, but the important things are eventually there's fat, right? That's why it's a fat cell. And it looks kind of like an oil, like a fat oil. Okay? And believe it or not, there is a certain amount of hydration in there. There's a certain amount of, quote unquote, like water within the cell as well. All right? So those are the two important things. Those things leak out and the cell dies. So that's why pressure is so important. Now, why was pressure not so important, say, 10 years ago? All right. Well, 10 years ago, when we're doing fat transfer to the buttock, plastic surgeons were actually putting the fat deep. Okay, they were purposely putting the fat into or deep to the muscle. Okay, which we know today that's the wrong thing to do. All right, but back then it was being done on purpose, and the muscle has a very, very robust blood supply, and therefore, at that point in time, it wasn't so important to not put pressure, and so there were surgeons that would say you could sit the next day, especially like in other places like Colombia or Dominican Republic where they're doing a lot of fat transfer into the muscle. All right, and that's why we get that confusion a lot nowadays. But today, 2023, we know that we don't want to put the fat into or deep to the muscle because that is dangerous, right? That's when you can get a fat embolism and the patient can die. So you don't want to do that. You want to put the fat in the superficial space that's between the skin and the muscle. That's the safe space. And there, the pressure issue becomes a lot more important. And that's why we say, no sitting, no putting pressure on the buttock or hips for 6 weeks to get as much fat to survive as possible. All right? Okay. So we got blood supply issues, we got pressure issues. Along with the blood supply, of course, the nutrients. But that's why we also want to feed the fat, right? We want to feed the fat, okay? So we want to feed the fat. So what does that mean? For the first 3 months after your BBL, you want to increase your healthy fats in your diet. What are some examples? Avocado is a great example. Eggs, if you like fish, salmon, red meat is okay. If you like nuts, macadamia nuts, okay? But those are really, good sources of what we call healthy fats, okay? And if you're struggling and you really need to keep that weight up, then go ahead and have some milkshake and ice cream, okay? How about you guys send us some likes for milkshake and ice cream, huh? Yeah, all right. Everybody loves milkshake and ice cream, and actually in the first 3 months of your BBL, that's one of the times where you can kind of, really go for it. Have your milkshake, have your ice creams, make sure you don't lose any weight because it's really important that you don't lose any weight whatsoever, okay, from your baseline operative weight in the first 3 months after your BBL, okay? After that, if you want to get fit and everything else, that's okay, but we need those initial 3 months, okay? So that's where nutrients come in. And then we have the technical issues, right? So why do we use certain cannulas? For example, for the fat transfer, I use a blunt tip single hole cannula that's at least 4 millimeters in size. That's used for two reasons. One, because it's a strong cannula, it's not going to bend, it's going to go exactly where I want it to go. Okay. But number two, there's less what we call shear forces on those little fat cells. All right. If you have sharper cannulas, if you have multiple small hole cannulas, if the cannula is way too small, all right, including the lipo cannulas, then you're going to have more shear forces on those fat cells, which means that you're shearing against that cell membrane and you're basically busting open those fat cells, and of course a busted open fat cell is not going to survive, okay? So you want to be careful when you do your lipo, you want to especially be careful when you do your fat transfer, and you got to use the appropriate tools for that, okay? And then lastly, I have here heat, okay? And that's why you really can't do fat transfer after, for example, what people call smart lipo or laser lipo, right? When you're doing laser lipo, the first thing you do is you're putting that laser in, it's imparting heat, and you're literally melting the fat, which means you're melting the fat cells, so all those cells are dead and they don't work. You can't transfer those fat cells. Alright, so you can't do fat transfer with smart lipo. You can't really, there's some people that say you can, I don't know, I don't really believe it. You can't really do fat transfer with vaser lipo because again, you're using now this ultrasound energy that's imparting heat upon the cells, which may cause them to rupture as well. Okay? And then lastly, a lot of you guys know that we use the Body Tight. Actually, we use a lot of Body Tight. We're the #1 clinic in all of Florida for Body Tight. We have the most experience. Yeah, send some likes there for Body Tight. We have the most experience with that procedure here in Florida. And what I'll tell you is if I'm going to use the Body Tight, I'm going to do the lipo first. Okay? So you want to do your lipo first, make sure you're not injuring those fat cells, and then you use the Body Tight because by definition, the Body Tight uses that radio frequency energy to heat up the tissues, to heat up the skin, to then allow for that skin retraction. Okay? So once again, heat will definitely affect your results. All right? And so if any of these things happens to your cell membrane busts open, the little fat kind of oil leaks out, and the hydration within the fat cell leaks out, and then that cell dies, and then your body basically reabsorbs all that. It goes through your lymphatic system, and eventually out your excretory, basically your liver and your urinary system. Okay, and that's what happens there. So we can, for most patients, or I would say the average fat loss, the average amount of fat that gets absorbed is about, then let's put that here, it's about 30%. Okay, here at Pure. Nationally, it's anywhere up to 50%. But we've refined our techniques. We've been able to lower it from 50% to 30% here at Pure. And that's pretty much the average. Of course, it's going to vary from patient to patient as well. And it's going to vary from the area as well, like we said, where you can retain more fat in the gluteal area versus the hip area. But you very rarely, extremely rarely lose it all. I have never seen it where you lose it all. The most I've seen you lose is probably about 50%, and that would be like in a tight hip area. Okay? So is it worth doing? Definitely. Definitely worth doing because you're going to improve the area. You may lose 50%, but it's going to look a lot better than when you started. And you can then build upon that too. You may have to come back for round 2 to achieve the look that you want. Okay? But it's a building process. You can think of it like Legos, like stacking blocks. Okay? All right. And at the end of the day, that's not a terrible thing if it gets absorbed. What's worse than getting absorbed is fat necrosis. All right? That's the next thing that can happen. So with fat necrosis, the cell dies. That's why we have that word necrosis, which means death. So we have fat cell death, okay? But your body is not able to absorb it, and it clumps up, and it becomes basically a ball of scar tissue, which sometimes can feel like a very hard ball underneath the skin there. A lot of patients describe it like a golf ball, or it depends on the size, but they feel this hardened area underneath their skin, and sometimes depending on where it is and where you're sitting, it can cause discomfort. Okay? Now, is fat necrosis in and of itself like a danger? Like, is it dangerous to your health? Is it going to affect your overall health? No. Okay, but sometimes you can see it. It can look unsightly, right? And sometimes because of where it's located and depending on how you're sitting, it can cause discomfort. Okay, and that's why a lot of people, if they get fat necrosis, they want to get rid of it, basically. All right. So why does fat necrosis happen? Well, it can be because of any of these things that we just talked about regarding the absorption and causing the cell death. But typically, it's that combined with it happening in large volume. Okay. So I think this is something that actually happens a lot. It's a lot more rare, and especially with us here at Pure, I would say that my incidence of fat necrosis, it's probably, it's probably less than 1%. Okay, but let's say 1%. Say it's about 1%. All right, and why is that? Because I don't try to overdo things. Right? If you put in way too much fat into an area that has limited blood supply, you're going to run the risk of fat necrosis, okay? Also, if you clump it all up in one spot, right? When we do the fat transfer, we want to kind of spread it out. You want to spread it out throughout the buttock area, so you have fat cells that are kind of spread out throughout the entire thing, so they can get better blood supply, more oxygenation, more nutrients, okay? And you put this huge pool of fat into one specific spot, then you have a much higher risk of fat necrosis, especially for those cells that are kind of in the middle of the pool, right? Just imagine like a lake, okay, and there's maybe some blood supply on the periphery of the lake, but nothing's getting to the middle of the lake, and then that lake basically becomes a scar ball, okay, and that's typically what happens. So you want to be careful with this. You want to be spreading the fat evenly. You don't want to be overdoing it so you can minimize your risk of fat necrosis. And if you do that properly, you're never going to have zero. Remember, nothing in medicine is 0%. But you can get that incidence, at least for any significant fat necrosis, you can get that incidence to be pretty low, probably in the 1% range, okay? Now the problem with fat necrosis is that your body's not going to absorb it, so then how do you deal with it? And it's not easy. Unfortunately, it's not easy. So there's typically a few options. The first option that I typically try is to break up that scar ball of fat necrosis with the cannula. So again, not making like bigger incisions, using the same small incisions, breaking up that scar ball with the cannula, trying to get it from like a larger, area of scar ball, and then break it down to little tiny ones, which your body then can potentially absorb. Or at the very least, it's not this hard thing that you're sitting on that's causing discomfort. And that's what I try to do first. I would say probably a lot of the time, at least 50% of the time, that works, and the patient is happy with that, okay? Now, if that doesn't work and the patient is still uncomfortable, sometimes you have to do what we call direct excision, which now means additional scarring, because we've got to make an incision. We've got to cut the skin right over the area of the fat necrosis and physically dissect down, remove the entire fat necrosis, and then close everything up, which is going to alleviate the problem, but it's going to leave a scar in that area. So unfortunately not a great solution there. So the best thing to do is just try to avoid fat necrosis as best as you can. Okay? All right. And then last, okay, and this is what everybody wants, the fat survives, okay? So when you have good technique, you're not overdoing it, you're putting it in the right places, okay, you get the fat to survive, all right? And that means that the cell membrane remained intact, okay, even though it was fragile. It also means that the patient did their part. Remember, it's not all about the surgeon, all right? The patient has to do their part. They have to make sure they don't put pressure on the area. They have to make sure they're giving the adequate nutrients and feeding the fat, all right? So, all right, compliant patients are super important. That's what it's all about. So make sure to send some likes over to compliant patients, all right? Those are going to get the best results, definitely, okay? All right, so yeah, fat survival is what we want. And what happens though is that you are going to go through a curve. I call this the buttock fat volume curve, okay? And this is kind of what it looks like. So at the beginning, when you first have surgery, you're going to have the most volume. Why is that? Because you have all the swelling and you have all the fat that you just transferred, okay? Then you're going to start getting on this down curve. You're going to get on this down curve because why? You start to lose the swelling, okay? And we start to lose some of that 30% of the fat. So you're getting onto this down curve, and then what happens? Somewhere around 6 weeks, you're going to get to the lowest point. Okay, that's going to be the lowest point, and that's because you've lost basically all the swelling and you've lost whatever fat you're going to lose. Okay? But something else is happening. The cells that have survived, okay, the 70% or so of cells that have survived, they've also shrunk. They've become dehydrated. Remember when I said that we're kind of like fragile, and the inside the fat cells, not only just the fat itself, but also basically some water, some hydration. All right. Well, because these cells have been struggling to survive. Okay, they're kind of like shrunk. They're strong, but they're shrunk and they're dehydrated. Okay. And now at 6 weeks, you're like, okay, finally we've established a blood supply. We've survived now. Nothing's gonna happen to us. And then those cells rehydrate. So you get some rehydration of the cells. And of course, within the fat, there's always some stem cells which can also multiply a bit, and as you get into that upward swing, which is around three months out. This is around 3 months out. Okay. So people ask me, Doc, do you believe in the fluff fairy or in the fluff phase? I certainly do. Why? Is it some sort of magic? Does the fairy really come down and bless your butt? No. Okay? But what happens is that those fat cells that survive are now hydrating, so they're getting plumper, right? And some of those stem cells have divided and created a few more, and the combination of those two things allow for the fluff phase. Okay? And that's what happens there. All right. So I think I've talked quite a bit, but I hope this makes it clear. I hope pretty easy to understand there. And I'm happy to answer questions about this or anything else you may have.
Yes, let's start with questions, but we need likes at Instagram and TikTok.
All right. Send us those likes.
Doug, the first question is at YouTube and says, how many pounds of fat can be allowed to remove? Or liters, I guess.
So yeah, it's not typically in weight, so it's not in pounds, but we're allowed to remove up to 4,000 cc's or 4 liters of fat here in Florida. Now this does vary from state to state, and it certainly varies from country to country. But here in Florida, in the office-based outpatient surgery setting, the max that we're allowed to remove in one surgery is 4 liters of fat.
When's fluff stage again?
When is the fluff stage? So you're gonna notice it around 3 months. Okay, so that's why I say so now it all makes sense, right? So why do we say no sitting, no pressure for 6 weeks? Because that's when we're trying to get as many cells to survive. Once you get to 6 weeks, whatever cells that we're going to survive have survived. Whatever cells that have died off have died off. But now these cells, they're small, they're shriveled, right? They're dehydrated. So now we got to fluff out those cells, and that's why we say that you want to feed the fat up to 3 months after surgery, because now we got to continue to feed those cells that have survived, okay? And get them all pumped up and rehydrated once again.
This one's in Spanish.
Sure.
Doctor Ale, ¿qué pasaría si no tratas un seroma encapsulado luego de un año de un tummy tuck?
Bueno, si el seroma ya está encapsulado y ya ha pasado un año, por lo general hay que tratarlo con cirugía, o sea que hay que volver a cirugía, hay que abrir el área, remover toda esa cápsula por completa, ¿ok? Y de cerrar de nuevo con unos drenajes. Y esa sería la única manera de tratar un seroma encapsulado ya después de un año.
Okay. How much ice cream can I have?
Oh, as much as you want. So here's the goal. In order to set the limit, right? So whatever weight you come in for surgery, that is your new baseline weight. Okay, that is the weight that you have to maintain for the first 3 months. The baseline weight to plus 5 pounds. That's your range. Now you should never go below your baseline weight. Do not go below baseline weight. And at the same time, you don't want to exaggerate, right? You don't want to gain 20 pounds. That's going to be way too much. So you want to be between baseline and plus 5 pounds. That's the sweet spot right there. But keep this in mind. Because you just went through a big surgery, your body's gone through what we call surgical trauma. You're actually your body's actually using more calories than you would normally. Okay, so you have to consume a bit more calories than you would normally for those first 3 months.
Why no smoking before surgery?
Great question. So smoking has, nicotine, all right? And what nicotine does is that it vasoconstricts your blood vessels, all right? So if your blood vessel is normally this big, now it's this big, which means, of course, that there's less blood flow, less oxygenation, less of all the nutrients and everything that your body needs to heal. So when you have nicotine in your system, that means that the chances of complications go up, and these complications are typically necrosis, whether it's fat necrosis or skin necrosis, so basically skin or fat death, okay? Open wounds, poor wound healing, and infection. The rates of all of that goes up when you have nicotine in your system.
Did you study at Duke?
Yes, I certainly did. Actually, Duke is where I did my plastic surgery training. So I was there for 3 years, and that's where we learned everything having to do with plastic surgery, whether reconstructive or cosmetic.
Do you work with medical marijuana patients?
Yes, so THC, marijuana, THC, CBD, all of those in and of themselves are okay. It doesn't really interfere with your anesthesia or your wound healing or anything like that. What you have to be careful with though is to make sure that whatever delivery method that you're using does not have nicotine in it, because we've seen a lot of times where some of the wraps, whatever system that you're using, delivery system, has nicotine in it, whether you know it or not. But the problem is that once you come here and we do your test, yes, the THC is positive, which we don't mind, but the nicotine's also positive, and that's a problem. And then we have to cancel your surgery. All right. So if you come here, we do your urine test, and it's only THC, and everything else is fine, we're good to go. But if your nicotine is also positive, then surgery gets canceled.
So in the same topic, when I should stop smoking before surgery?
So you want to stop at least 30 days, from 30 days before surgery to 30 days after surgery. It's extremely important. But I always say, if you're going to stop at 30 days before surgery, you might as well just stop it for the rest of your life. Nothing good comes out of smoking or nicotine. All right? So I say stop 30 days before surgery and never start again.
Doug, could you speak a little bit about your anesthesiologist team?
Yes, so we have a team of what we call anesthetists. So they're called CRNA, Certified Registered Nurse Anesthetists. We have a great team now. We have 4 different team members that work with us. They're truly excellent, and they'll take very great care of you. Many years of experience, and we trust them fully.
Okay. Hello, Doc. How do I know if I have enough fat for a BBL? Or if fat from a skinny BBL is enough?
Yeah, so the easiest way to know is to go ahead and send us your evaluation, right? So you go to our website, go to www.pureplasticsurgery.com. You're going to hit the button that says, virtual consultation. There you're going to fill out a questionnaire and send us your photos, and then I'll be able to take a look at all that and determine whether you are a candidate for your BBL. Okay, that's kind of the most direct way to get a for sure answer. Okay, now just so you get a ballpark though, we can go a little bit with BMI, right? So typically for most patients, if your BMI is 21 or above, then you would have enough fat at least for a skinny BBL. If you're between like 21 and 23, that's what we consider a skinny BBL. And we want to make sure that your expectations are realistic, right? We're only going to have so much fat to work with, so you have to have realistic expectations there. Those patients typically want what we call an enhanced natural type of look. Okay? Now, for most patients, if your BMI is below 21, then typically there's not enough fat for a BBL for fat transfer.
Can under boob lipo be done with breast lift implants? I guess it's area, right?
So yeah, we can certainly add that. So we can add lipo to the axillary areas. We can add lipo to the lateral breast under the kind of under the armpit area there as well. So yeah, it's certainly something that can be added. As long as we don't hit our limit. So remember, here in Florida, when we do a cutting surgery such as a tummy tuck or a breast lift, then we're limited by the Florida Department of Health to 1,000 cc's of fat removal via liposuction. But as long as we're kind of within that range, then we're able to do that.
After a BBL, can a faja that's too tight cause fat necrosis? Should I wear a looser faja?
Yes, right. That kind of comes back to this here about the pressure, right? So a faja that's too tight in the wrong, let's be more specific. A faja that's too tight in the wrong places can cause a problem, right? So if the faja is too tight in the hip and buttock area, that's going to increase the pressure. Remember, you're wearing that faja night and day for the first 6 weeks, so it's basically a constant increased pressure in the area where we just transferred the fat, and that could potentially lead to more fat dying off and being absorbed. Okay, so you want to make sure that your faja is not putting too much pressure in the hip and the buttock area. You always want it to, of course, give you some nice compression along the waist and the trunk, but the hips and buttock, that needs to be basically free of compression.
How many hours does a lipo and BBL takes?
So that's going to depend on many factors. It depends on the surgeon, depends on the patient, depends on whether there's any add-ons. So for example, I've been doing this for many years. I have a ton of experience, over 3,000 BBLs, over 2,000 of those with ultrasound, and so I'm very efficient. And I would say for your regular or maybe slightly lower BMI patient, say a patient that's a BMI say of 24, that's having a straight BBL with no add-ons, it could potentially be done in an hour and a half. Okay, but say now you have a patient that has a BMI of, my max BMI say that's 30, so you have a higher BMI patient who also wanted to add say thighs and arms, and then wanted to do face tight to the chin, right? You start adding things on, well, of course, that's going to be a longer surgery. It could be 2.5, maybe up to 3 hours. Typically never longer than 3 hours for me. Now, other surgeons, it could take them longer. I've heard of surgeons taking sometimes 5 or 6 hours. I'm not sure what they're doing for that amount of time, but it's a possibility. So the range is wide, but I would say probably, for me, somewhere between certainly somewhere between an hour and a half to 3 hours, depending on the patient, how many add-ons we have.
Doug, your followers at TikTok send you a dinosaur, a lion, flowers, and some hearts for Valentine's.
All right.
But we're missing like 200 likes, so we're almost leaving.
Okay, all right.
Okay.
I like the dinosaur though.
Yeah, it's moving around the video.
Excellent. All right, that's it. Okay, excellent. Well, so I hope this is now understood. And of course, if you guys have any specific topic you want me to talk about, go ahead and send that to us. You can send it through a DM or in the comments, and definitely we'll look into exploring those topics for you as well in more depth. But otherwise, I look forward to seeing everyone next week on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.